welcome to this Vattikuti Foundation webinar series. It's an interesting topic, and we have two experts in the field. We have Dr. Sahil Chopra from the Empower Sleep Clinic in California, and we have Dr. Saurav Luthra from the University of Kansas Medical Center. I'm going to turn it over to Dr. Chopra.
David, thank you. Thank you for handing it over. Welcome, everybody. I hope we're not interfering with your sleep. It would be sort of counterintuitive to do that, and just realizing that we have people from all over the globe. For those who are about to go to sleep, hopefully we'll give you some good tips. And those of you who just woke up, hopefully we'll give you some more tips that you can apply throughout your day to then hopefully get a good night's sleep tonight and then moving forward. My name is Sahil Chopra. I'm a pulmonary critical care and sleep physician. I have humble beginnings from med school in India, did my residency in California, and then pulmonary critical care fellowship in California as well, followed by a sleep medicine fellowship at Harvard. And that's where I had the pleasure of running into Dr. Luthra. Dr. Luthra, I can tell you many stories about him, but I won't. But he has a very humble beginning in Delhi. He did his medical school from King George in Lucknow. He came to the States, did his residency in Rochester, New York. And after that, he decided to work for a couple of years as an internist at a hospital system. From there, he got interested into sleep medicine, and that's how our paths crossed. We ran into each other at Harvard Medical School doing fellowship. And since then, we've become very good friends, colleagues. Our wives are friends as well. And he does very good with our children. He's probably a father to be at some point. And I'm really excited to have this conversation with you, Saurav, about how to get a good night's rest.
Same here, Sahil. And Sahil is an innovator, I would say. Great pulmonary critical care physician, and then a very good sleep physician. And he has started his own virtual sleep clinic. And I think he is doing the task that we all want to do in sleep medicine, is to make the sleep care more approachable for folks that do not have a sleep doctor nearby, and just increase the awareness on sleep. So thank you, Sahil, for that introduction. And I also wanted to thank the Vattikuti Foundation and MediCouncil for giving both of us this opportunity to talk about sleep. Their CEO, Dr. Bhandari, who is a very inquisitive mind, an excellent teacher, clinician, surgeon. And so we're really grateful for this opportunity today. Basically, we will try to keep this, as a conversation on sleep. I think, we spend almost 1/3 of our lives sleeping 8 hours every day, but we don't think that we talk about sleep that much. But the goal of this conversation would be trying to emphasize on, what sleep does for us, why is it important, what happens when, we don't get good sleep, and, even though the science is still evolving in the field of sleep medicine, but what do we know so far? And then how do we try to correct some of the common problems with sleep with what we know in biology so far. So I think the number one question that I could think about, when I started to make this webinar was, why should we even care about sleep? Everybody sleeps and they wake up, and that's been happening, for thousands of years. So why do we care about sleep? I found this very good quote that I wanted to put here, is that sleep is not a luxury. It's important for our physical and mental health, being as important as food and water. Because if you really think about the basic functions of a human being, in order to survive, what do we need to do? We need food, we need water, and we need shelter, and then we need sleep. And that's something that is evolved through evolution. And the whole evolutionary way of looking at sleep is really interesting. What we find is that even though, as the life was evolving on Earth, As the life got more complex, there were several, predators. Even then, the brain decided to make out a phase which was 1/3 of your day, where you would be completely devoid of a lot of sensations, which would put you at risk to be eaten away by the predators. But the brain still decided that we needed that sleep. So that gives you an idea of how important sleep is. That by evolution, the human beings, basically all mammals and many animals, even less evolved than mammals, have some sort of a sleep going on. And the importance of sleep, as we have realized, is in a multifaceted way. It not only helps the brain to recuperate from everything that happens during daytime, it helps our thinking, it helps our memory. There is a theory of preservation in sleep, that one of the reasons why we sleep initially as we were evolving was just to preserve ourselves, because we did not need continuously to eat 24 hours a day. So evolution decided that we needed to rest, because otherwise we would be wandering around and then could be get killed by a predator. So there was a preservation theory that sleep kept us from at least 8 hours of the day from doing any of that. There is a neurochemical theory, a neurobiological theory on clearance of waste products in the brain that sleep does for us. We know that several immunoglobulins are cleared from brain when we sleep. We also know that beta amyloid, which is a protein fragment, and we know that this beta amyloid is also associated with Alzheimer's and a lot of neurological diseases as people get older, is getting cleared from the brain during sleep. We have tiny channels in the brain, sort of like the lymph channels, that help us clearing this waste. So sleep has a role of clearing out the waste materials at night. It has a role of restoration, which is basically allowing every organ system to go on a more restful state and start to prepare for the next days. For example, your heart, the heart rate slows down during sleep. There is a nocturnal dipping in the blood pressure, which is extremely important, as we have realized that people who are not getting nocturnal dipping on large scale population studies are associated with more cardiovascular problems. So that dip in blood pressure is important. The glucose metabolism, so all the endocrine functions are also extremely active during the sleep time. We know that if we don't sleep very well, hormones such as cortisol, which is the stress hormone, and a steroid goes up in the body. That would lead to high blood glucose, that would lead to more fat deposition. We know that free radicals and antioxidants are also altered with good and bad sleep. And we also know that people, when their sleep start to fragment or they are not sleeping well, their recall of things are affected. So there is a very important, benefit of memory processing, processing of what we all absorbed during the day, during the sleep. And there were several studies done that showed that people, if they read something and then they slept after that, the recall was a lot better as compared to reading something and not getting enough sleep after that. And really, when I try to explain sleep or understand sleep for myself, I try to not think of sleep as something which is boxed inside the brain and it is only happening in the brain tissue. The newer understanding on sleep is that the complex neurobiology of sleep is really a network phenomena. There is a complex network of neurons in the brain that are obviously interacting with each other, doing our memory, doing our waste clearance processes, but they're also at the same time interacting with the autonomic nervous system and the more peripheral nervous system to try to regulate basically all the organ systems. So there is now data to show that pretty much all organ systems have a diurnal rhythm. They are going through day and night cycles, and there is important biological and physiological processes going on at night, which keep us healthy and going forward.
That's really interesting, Saurav, that you bring all of these things up. I mean, a lot of people, I remember, even in like the healthcare space, in residency, medical school, we don't talk about sleep. It's in fact, it's one of those things that it's sort of looked down upon, you know, with people like Elon Musk, who just tweet that they sleep 5 hours, are really setting the wrong example. I used to have my head of department would tell us, oh, I only need 5 or 6 hours of sleep to be able to function well, and look at me. And it just sort of highlights that, you know, there are people who can function off of less sleep, but sleep is fundamental for normal functioning. Seeing your quote sort of reminds me of another quote. It's written by a sleep physician, and it's sort of like this, that if sleep does not play a fundamental role in life, it's the biggest evolutionary mistake that happened.
Right. And we all know that nature does not make mistakes, right? Evolution does not make mistakes.
Exactly. And the other thing that sort of comes to mind is, one of the things that I would tell patients in clinic all the time is, or I still tell patients in clinic, is think of sleep sort of as your housekeeping process. And imagine a hotel that doesn't get its housekeeping done, or its housekeeping is being cut short. And if that happens, you can only imagine how inefficient that hotel or that business is going to run if you're not giving it enough time to restore and prepare for tomorrow.
Right, and excellent point.
You highlighted all of these points really well.
Yeah, no, I think those are all very excellent points. Yeah, and you were exactly right on.
Saurav, could I butt in here?
Yes, Dr. Bhandari.
Thank you very much, Sahil, for making it interactive, and thank you, Saurav. I had to join 2 questions which you can include in your discussion with my personal experience.
Okay.
Joining Sahil on number 1 question I have is, what is the objective of the sleep? I find a lot of misconception about sleeplessness. It is the satisfaction, or it is getting into deep sleep for an X number of hours without bothering about quality. So one question I have is, what is the objective we should go with the sleep? Second thing is, another misconception is, when whole world sleeps, that has become a universal phenomenon. If I don't sleep in the night, I sleep in the day.
Yeah,
I have a bad sleep rhythm, which I have beaten in my career, because I was an avid traveler till COVID. I will be traveling every month.
Right.
If you go to India for one day, there is no time for you to get over jet lag. So over the years, I trained myself. I need to sleep. I don't care when do I get the sleep.
Right.
And always, according to the clocks in India, at 3 o'clock, I will have to sleep. And I always plan my program that go in the room and have a nap for half an hour. It doesn't need, it's a power nap you need it.
Right.
You go to California, the rhythm changes. So my question to you is that this misconception, and what I do is, my mails you will see when I travel would be at 1 o'clock, 2 o'clock, because I follow my own rhythm and I'm fine with it. But whereas I see people go, everybody's sleeping, I am not sleeping. So that is a misconception I want to have. Second thing, what Sahil raised a point, the number of hours is not important as far as I am concerned. It's the quality of sleep, and your body tells you whether you have rested enough or not. And in spiritual word and meditations and all, we are taught that even if you are not sleeping deep, if you are lying flat and just in a state of let thoughts come and go, 4 hours is good enough for you to rest the body. So I think this misconcept about general phenomenon of sleep, if you can add to your talk, I'll get answers to some of my questions. Thank you.
Okay. Absolutely. Those were excellent questions, Dr. Bhandari, from real life experiences. Sahil, do you want to take anything? Then I'll join.
Yeah,
I want to touch the circadian issue there.
Okay. Yeah, no, it's really interesting about sleep. Even when we look at like population statistics, the average sleep duration among population is between 7 to 9 hours. And if you take someone who's biologically speaking a 9-hour sleeper, and you have them sleep, 7 hours a day because that's what socially is acceptable, over a course of a week, you can only imagine they'll develop a 10 to 12-hour debt of sleep and how poor they would function over time. So definitely like personalizing one's sleep need, making that a priority, and then working around it and not comparing your sleep need with other people's sleep need. And sleep, as long as it's healthy, it oscillates between deep sleep, shallow sleep, and REM sleep. So as long as you're giving yourself the opportunity to sleep and it is not fragmented, one will have those normal oscillations of different stages of sleep over the course of their sleep duration. So for most people, if there's no pathology, they will get the appropriate amount of sleep if they give themselves the opportunity.
Right. Excellent points.
I'll hand it over to you, Saurav, for like the circadian question that Dr. Bhandari was asking.
Yeah, I think just on the duration of sleep, I'll say that, most of the studies that show that you need at least 7 hours of sleep are population-based studies. So they study a large number of patients, or, not even patients, healthy population, and they determine that this is the average number of sleep that people need. But we know that everybody's sleep requirement can fluctuate anywhere from 4 or 5 hours to 9 hours. So that there is a range of what you need to sleep to feel refreshed. And only you would know the best, not your doctor. You would tell them that what are those number of hours that you have been sleeping when you were young, when you were younger, when you did not have all the stress in life, when you had a little bit more flexibility in, sleeping whenever you want and wake up a little bit, whenever you want. And then you will come to a number where, you sleep that many hours and you woke up and you were refreshed. And that is really how much sleep you need. For some person, that could be 5 hours. For some person, that could be up to 9 hours. And there is this range in population. We also know that just a few weeks ago, there was a very interesting study that they took a family of Mormon faith people in US, and all the people there would, sleep only 5 hours. And they'll wake up at 4 a.m. and they are all, very active, highly achiever people, and they discovered a short sleep gene in them. So now we know that there is a gene. If you have that, your sleep requirements are only 4 or 5 hours, and you're just basically blessed. It's a gift. You only need that much sleep. You wake up refreshed. They also found that this gene was associated with personality traits of, type A personality, overachievers, always functioning, getting a lot done during the day. So you could be one of those people, but I think in general, 5+ hours of sleep is needed overall in the population. And if you generalize it over the entire population, around 7 to 8 hours is needed to feel fully refreshed. Then we come on to the part of quality, which is extremely important. So there's basically 2 pathologies with sleep that can happen. One, your quantity is not enough, and that quantity is not enough relative to what your brain's requirement is. And second is the quality of the sleep. And quality of the sleep is determined basically by, how fragmented the sleep is and what is the depth of the sleep. So the fragmentation can happen because of anything that wakes you up. It could be a bad sleep environment. It could be noise. It could be a breathing issue at night that is waking you up. It could be a automatic movement issue, such as limb movements that are waking you up. So anything that fragments your sleep reduces your quality. And then when quality is reduced, even if you get, let's say, 7 hours of a bad quality sleep, you will not feel refreshed. The second thing with quality is the circadian issue, or the internal clock issue that Dr. Bhandari was touching upon. When you travel, your brain's internal biological clock, when the brain is ready to sleep and ready to wake up, moves a little bit, but doesn't move a lot. So for example, if you were getting sleepy around 6 or 7 p.m. in US, and now you're in India, you will be getting sleepy in the morning around 5 or 6 a.m. because that's really where your biological clock is still stuck. So that was an excellent point that, you want to sleep when you are sleepy. You don't care, if you are traveling and you're jet lagged, you don't want to care about when the world is sleeping. You want to keep your rhythm consistent and sleep when you get drowsy. That's probably where your biological night is. And then wake up, when you are feeling refreshed. What that does is when you sync your bedtime and wake up time exactly with your biological night, which is when the brain is ready to sleep, that is really when you will get all the depth and all the good quality sleep that you need to feel refreshed. People who are actually advanced sleep phase, which means they start to get drowsy a little bit early in US, when they travel to India, their sleep gets a little bit less affected, I almost feel, because early part in the morning, you again start to get drowsy, which roughly corresponds to your advanced sleep phase. So yeah, so I think the syncing your sleep with your internal clock, getting the hours that you think you need to feel refreshed are important. But there's also a misconception that highly functional, highly intelligent people only need a few hours of sleep, and that's how they have trained themselves, and they have developed this habit because what your sleep requirement is genetically will not change by training. You can train yourself to sleep less, but probably you're still functioning in a slightly sleep deprived situation, and you're catching up on the weekends when you have time. And we know that your overall functioning, your thinking, your processing, your productivity is not the same, even if you're sleep deprived for 30 minutes or an hour. So I think, what you need to sleep and feel refreshed, identify that for yourself, get that much sleep, be your most productive, when you are awake. And that's really, I think, a good way of thinking about sleep.
Yeah, wonderful points, Saurav. Wonderful points. I mean, one of the things that just comes to mind, I know we have more to talk about, but this is just so interesting, and it just sort of highlights the point. In rats, for example, if you keep them awake long enough, and I think that number is close to 14 or 15 days, that they will die of a critical infection. Like that's just,
yeah.
And the way that they would do these studies is they would put rats on a pedestal, and every time they would fall asleep, they would fall into a puddle of water. And so basically sleep depriving them for long enough, and then what happens is they die of a critical infection, septic shock. It just highlights how important and critical sleep is for one's overall well-being.
Yeah, and that touches on the point that there is an immune function of the sleep, right? And there have been studies done on the influenza vaccine that when a vaccine was given and a percentage of people were not getting more than 7 hours of sleep, their immune response to the vaccine was much weaker. So, and this is very pertinent, I think, with all the COVID vaccinations going on all over the world. If you're getting a vaccine, it's really important to get enough sleep at night for your body to generate a strong immune reaction to that.
Okay, good points.
So this slide, I just wanted, because we were talking about sleep biology, I wanted people to just get a brief idea, not too much going into deep into that, is that, we cycle through sleep stages. There is a stage 1, slightly lighter sleep, stage 2, slightly deeper, stage 3, which is really the deepest of the non-dream sleep, and also known as the slow wave sleep or the delta sleep. The timings are given there, for 5 minutes, you will be in a stage 1, about an hour in stage 2, maybe about 30 minutes in stage 3, and then you go into the dream sleep, which is where you are getting the most vivid dreams. And this whole cycle happens over a period of about 2 hours, and then we repeat this cycle. So sleep is not a continuous phenomena where you start and then you are in a deep sleep and then you stay there for 7 hours. You're going through different stages. You're coming to a dream sleep. There may be an arousal once this entire cycle ends, and you may even wake up, but that would be completely physiologically normal. And then you again do these cycles, and you can do 2, 3, 4 cycles depending upon your sleep duration. So then I wanted to touch about, what happens if we don't get good sleep? What is the impact of poor sleep? Why should we care? Coming on the same, theme. Number one, that gets everybody's attention is cardiovascular problems. I feel like this gets the attention right away. If you tell somebody, they'll get a heart disease. And this is very true for sleep. sleep leads to a poor sleep, a broken sleep leads to issues with heart rhythm. So issues such as atrial fibrillation, which is irregular heartbeat. It leads to high blood pressure because you don't get that nocturnal dipping in the blood pressure that you get with a good sleep. It leads to thickening of your heart muscles even, because if you have an abnormal breathing and your oxygen levels are going down at night, the lungs are working extra hard, the blood pressure in the lungs are going up, and that leads to more pressure on the heart to pump more blood with low oxygen levels. So your heart can get thickened, you can be developing issues with fluid overload. As Sahil was mentioning, a weakened immune system is extremely important. Weight gain, I think at least in the metropolitan cities in India now, and many cities in US, we have this obesity pandemic. And there is a vicious cycle with sleep and obesity. If you are getting obese because of poor, eating habits, you get a little bit more abnormal breathing at night. And that abnormal breathing leads to a fragmented sleep. That fragmented sleep leads to secretion of stress hormones that lead to further weight gain. And then more weight gain leads to more apnea leads to more weight gain. So you just get into this bad cycle where you gain a little bit weight and then you are just gaining weight, and it becomes harder to lose weight because now you don't have any energy to work out at all. So now you're always tired. And so this is very important, I think, the cycle with the sleep and obesity. We know that diabetes, pre-diabetes, and then diabetes develop in patients who have poor sleep. And then mental health disorders, which is another pandemic, I think, especially worsened over the last 1.5 years with people staying at home, less social interactions. So things like depression and anxiety are very well associated with a poor sleep. And like I said in the beginning, basically pretty much if you start looking into it, all organ systems will get impacted with a bad sleep. One of the common things I think about is the GI system. Our guts need to follow a pattern of when to do the peristalsis, when to move the food forward, when to develop a bowel movement. And these patterns, even if you don't realize, you may have certain time during the day that you get a bowel movement. And the reason that happens timely if you have your sleep and wake cycles on time. But if you break those sleep and wake cycles, the gut's response to when to expect food, when to do peristalsis, when to generate a bowel movement is all affected as well. So that's one example of how all the organ systems really get affected with poor sleep.
Yeah, absolutely. Like the interesting thing is so many of these things actually have a vicious spiral. Like the obesity one, people who are chronically sleep deprived, they have a tendency of eating more.
Right.
The satiety inhibiting hormones are at a much higher level in the obese people who have sleep apnea as compared to those who don't. In diabetes, it's also a vicious cycle. Your cortisol hormones, your sleep is fragmented, cortisol levels are higher, diabetes is going to be more difficult to control. It's just fascinating how it's just not only just being like an association or an impact, but actually a vicious cycle where both of these things are driving themselves into sort of a downward spiral. So all really good points.
Right. And then, I think of it, you try to treat these chronic conditions by just, giving them medications is really a halfway approach of treating these things, because you're not touching what is worsening these problems in the body. So if you just give insulin and you don't treat somebody's apnea, you're only half treating them, I think.
Very, very true.
So benefits of good sleep. So what if you are sleeping well? What do you get as a reward? People who sleep really good and they are regimented and they sleep at regular timings, it helps in reducing inflammation in the body. And we know inflammation is pretty much related to all the chronic issues, right? High blood pressure, even malignancies can happen with chronic inflammation, so cancers can develop. So sleep tends to reduce your inflammation at night. It improves your concentration because your brain is more rested. You wake up with a more clear mind, more rested. You can concentrate better, focus better at work. And like Sahil was saying, it's a vicious cycle. We know that people with bad sleep, they have a craving for more calories when they're up. And that has to do with their hormonal dysfunction. They crave for more calories. They crave actually for more carbohydrates and junk food than healthier food. And then that leads to obesity. It reduces the risk of heart disease and reduces your risk of stroke. There was a study done where sleep apnea patients were associated with higher atherosclerosis burden. And atherosclerosis, basically lipid laden into the arteries, is what really can give you heart disease and stroke. One interesting data I read, Sahil, was there's a study done in Europe where they saw a 20% decrease in the incidence of heart attacks in patients who slept more than 7 hours and they slept good quality. So that was like an excellent and such a huge impact by just sleeping well, 20% reduction in heart attack.
Yeah.
And then it reduces the risk.
The crazy thing is that, if something has a statistically positive effect of, even 10%, these things will make it into the New England Journal of Medicine as like a life-changing drug. And like something that is such a low-lying fruit of just being able to get a good night's rest can make a world of a difference.
Absolutely. If this was a Pfizer drug, it would be all over, right? 20% reduction in heart rate. I mean, we in science, we crave for, anything 5%, anything that extends your life by a few months in oncology becomes a new drug, right? But yeah, we think sleep, because it is passive, there's not much money behind, there's no big pharma behind, good sleep. So that's why I think it gets less attention, but we are realizing that, now more cardiologists, more endocrine physicians, more rheumatologists. I get, referrals from all of these because I feel like in the last 10 years, we have done a good job in, learning more science on sleep and trying to educate people on them. But there's still, a lot of way to go.
Absolutely.
So then, Sahil, I want to touch about this thing where, how do we know if we have bad sleep? Now, somebody might feel, I am sleeping 4 hours, I can stay up, I can drive okay, I don't, sleep behind the wheel. So maybe I don't have an issue. So I just want to touch on some common things that you could be getting that would suggest that you have some sleep issue going on. Number one is you wake up in the morning and you just don't want to wake up. So there's something wrong there, because if the sleep is correct and you're sleeping in your biological phase, you should be waking up feeling refreshed. That is the basic function of the sleep. So if you're waking up feeling tired, dragging your feet out of the bed, something is wrong with your sleep. If you are working in something that requires a lot of concentration and focus, things like accounting, medical profession, engineers, if you're having difficulty to focus on work, you may not have had a good night's sleep. You go to bed at night and you just can't fall asleep. That is a sleep issue. A lot of common things like, suddenly your mood over the last few months is more irritable. You're feeling, a lot of stress. Your mood is showing signs of anxiety, feeling sad. We know that these things have a interrelationship with sleep. So sleep can cause mood disorders, and mood disorders cause bad sleep. Sleepy during the day, that's a big one. If you always want to take a nap, if you would just lie down and would sleep within a few minutes, then you should not be that sleepy during the day. You wake up with eyes puffy, red, you're developing dark circles. That happens because of sleep deprivation. You should think about, improving your sleep quality. And then feeling hungry, coming back to that excess calorie point, you're feeling hungry, you're eating more junk food, gaining weight, not having enough energy to lose weight, exercise, it could be related to a bad sleep.
Yeah. The interesting thing is like so much of this is some of these things are so non-specific that one does not even think of sleep when dealing with these individual problems. Like we've started seeing kids in clinic, and in children, hyperactivity in adults, if somebody is sleepy, someone's sleep is fragmented or poor, they may feel sleepy during the day, but in children, it's the other way around. Children will present with inattention, hyperactivity, and the inability to focus, and then they get labeled as ADHD or ADD, some sort of a attention deficit disorder. And it's just the spectrum of symptoms of chronic sleep deprivation are so vague and so all over the place that it can be sort of challenging to find out what that that sleep is actually the root cause of all of these problems.
Yeah, and especially in children. And I remember, growing up, we would have kids in a class that, can't stay awake during the morning classes, right?
I was one of them, by the way.
Or they'll sit in the back because they're just very sleepy. They want to put their head down and sleep. And what do the school system says? They are just not good students, right? And you heard the word lazy all the time for people who are tired in the morning, and you can't concentrate, and that is going to lead to a poor academic performance, right? You can't perform in school well if you're missing classes, if you're sleepy through the classes. So that in children becomes a very important issue to identify early, that if kids are not able to wake up, feel refreshed in the morning, are not doing good in school, sleeping in the morning sessions, then their biological cycles are disturbed. And just by addressing their sleep, you can really make a lot of difference in some kids' academic performance and maybe their entire career.
No, absolutely. Because it's all compounded over time. Getting an extra hour of good classroom knowledge every day over a course of many, many years, it can completely change the trajectory of where a child is headed in life as compared to somebody in whom this was not identified.
Right. I mean, in US, there's a big drive right now to delay the timings when the schools start.
Right.
Because when they start very early, the people who are morning people, or we call them morning larks, are, it works out for them perfect. But what about the night owls? So they all suffer in school. So chronic conditions, touching the same point, if you have chronic conditions like diabetes, heart disease, high blood pressure, obesity, and any of these you are treating, but they are difficult to control. You're giving multiple blood pressure medications, you're giving a lot of rate control medications, and the heart is still racing, going back into AFib again and again. All those are signs of maybe you need to address the sleep as well. I wanted to then move on to just, what are the common things that can go wrong with sleep? And we talked about, a few of these already. But basically, I try to compartmentalize them amongst these 6 classes. One is the internal clock issues. So any desynchrony between your biological night, which is when the brain is ready to sleep and wake up, and your actual sleeping times are an issue with the internal clock. Examples are jet lag, like Dr. Bhandari mentioned. Traveling to different time zones would lead to an internal clock issue. Then shift work, working at night, and then you work at night on the weekend, you switch during weekdays into morning schedule. That becomes an internal clock issue. And then there are many others: irregular sleep wake, delayed sleep wake, advanced sleep wake. But they're basically all mismatch of this internal clock. Insomnia is basically, you're trying to sleep and you can't fall asleep. It could be acute, it could be chronic, it could be just secondary to some anxiety, or it could be a really primary insomnia where your brain just can't get sleep when it needs to. And it could be really resistant as well. Insomnias are pretty, if they are chronic and they are primary insomnias, could be really challenging to treat. Apneas. So apnea is really your abnormal breathing at night. When you're sleeping, this leads to decreased sleep quality and fragmentation. They can be obstructive, which is pretty much the most common one, where your airway is getting obstructed, you're not getting air in and out, and that leads to a drop in your oxygen, leads to an arousal, leads to the whole plethora of things that happens with apnea. It could be central, where in people with neurological disorders, or people with heart failure, or people on pain medications such as opioids, the brain does not send an impulse to the lung to breathe. So there is a central apnea there. And then there could be more complex apnea where there's a combination of obstruction and the decreased impulse, breathing impulse coming from the brain. Excessive sleepiness, which in itself can be a primary disorder, which means that you're not just sleepy because you have apnea or a clock issue or an insomnia, but you are sleepy because your brain is generating a lot of sleep. So there could be folks in the community that have this hypersomnolence disorder, and their brain requires 11 and 12 hours of sleep. And without that, they're not refreshed. And there are people, Sahil, that, idiopathic hypersomnia, where you have a requirement of 12 hours of sleep and you get that, but you're still not rested. And these people, I feel like, if they are misdiagnosed or they're not diagnosed, I feel really sad, because their whole life, really, the productivity, the functioning, everything just is going down the drain. You are spending 50, 60% of your life sleeping. And it's not because you are lazy. It's not because you don't want to work. It's because you have a central hypersomnolence disorder. So you have either an idiopathic hypersomnia or a narcolepsy, but it's not you doing it, it's the brain doing it.
Right.
And then, we have restless legs, which is a whole different disorder where people just can't get their legs restful at night. They'll move it, they'll shake it. I had a patient who gets up from his bed at night because he gets restless legs, and he lived on an acreage. He will go out and walk 5-10 miles at night, and then come back to bed and then go to sleep because he had that bad restless legs. The side effect was that the guy was very fit, so he would walk all the time, but he just couldn't sleep. And then we have abnormal behaviors, things like nightmares. In kids, we see sleep terrors, sleep anxiety attacks, sleep panic attacks, REM behavior disorder, where basically you're moving at night, or you're getting out of bed, or you are hitting your spouse. All those are abnormal behaviors at night, which could be another form of a sleep disorder.
Right. It's so funny that, like, if I was not in sleep medicine and someone said the restless legs syndrome is a sleep disorder, I wouldn't be able to put the two together. But because it doesn't allow you to get a good night's sleep, it really falls into the category of a sleep disorder. And I think sleep physicians are very well equipped to help patients sort of solve this problem and get it under control.
Correct. And we also know that there is a circadian rhythm to periodically movements. When you look at a sleep study, you would see that they happen during certain circadian phases where the automatic movements are increased. People typically get these symptoms when they are getting ready to sleep. So that means they are probably closer to their biological night when these symptoms are happening, which also associates it strongly with sleep.
Yep.
Okay. So simple techniques. I wanted to just put in 4 boxes, how to get the best possible sleep. And then we'll, try to elaborate more as, if we have more time. But number 1 is your bedroom should be sleep inducing. What that means really is you should have a comfortable, relaxing space to sleep. Sometimes it's very hard because I've lived in Delhi a long time and there's just a lot of noise outside. So whatever we could do to try to curtail the noise at night, keep it dark, keep it at a cool temperature which is comfortable for you, and your mind should start associating your bed with sleep, which means when you're in the bed, you're either using it for sleep or for intimacy purposes, but you're not using the bed to put your laptop on and then do complex Excel sheets on that, right? You don't want to do hyperactive stuff or hypervigilant mind stuff in your bed. The bed should be a place to either meditate, sleep, or for intimacy. You need to optimize the sleep schedule. What that really means is, I think the simplest way to do this is set up a wake-up time, okay? And set up a wake-up time that is comfortable for you. So if you're naturally a person who wakes up at 7 a.m. and that works with your job, that works with your profession, you keep that wake-up time consistent. Even if it is a weekday, even if it is a weekend, you don't try to move that. I've realized that it's easier for patients to tell them that, you set up a wake time, and then automatically the sleep pressures and the sleep drives and the internal clock systems makes them drowsy at a particular time at night and they can go to sleep. I felt that is harder for patients to regulate, but wake up time, because they are either working, a job, 8 to 5 job, is easier to keep consistent. So I emphasize on that. A pre-bedtime routine, which really means all the things you do 30 minutes, 45 minutes before you go to bed, should be a routine, and very important in kids actually. And routine could be, brushing your teeth, listening to some relaxing music, meditating, some deep breathing, anything that calms your mind, and anything that brain can think of as a habit that you do every time before you sleep. And we know that, we are creatures of habit, right? We, when we start to, learn driving, we have to think about everything, where is the clutch, where is the gear shift, and where is the steering wheel, how do I back up the car? But imagine after 5 years, when you have to take the car out of the garage, you don't think about it. Sometimes you're thinking about the meeting you're going to, and the brain just, does like 100 things within a few seconds. Your car is out of the garage. You never thought about it. So you can see how brain can, process thousands of activities if it knows that that becomes a habit. So a habit of, doing a certain things that are relaxing before the bed entrains your brain that you're getting ready to sleep and you're going to sleep. And then during the daytime, you really need to do habits which are healthy for a good night's sleep. So things like, Sahil, you were mentioning the other day, exercise is very important. And exercise early, not during the evening hours, because whenever you exercise, you have a lot of endorphins, you have a lot of stimulating hormones that are getting released. But early during the day, if you exercise, that starts to increase your sleep drive and sleep pressure and keeps you in a healthier sleep-wake routine. The other things healthy during the day would be avoid stimulants. So if you're drinking tea and coffee, and we know that tea is a very common beverage in India, and even here, and then coffee, you need to control those stimulants, because without realizing that tea is a stimulant, you're drinking it late in the evening, sometimes close to your dinner time, sometimes even close to bedtime. But basically what you're doing to the brain is you're confusing the brain. The brain is in the phase of sleeping, but you're adding a stimulant, so the brain doesn't know what to do really. So you need to control your stimulants, keep them limited, keep them during the before the noon time. And then another common stimulant would be nicotine. In cigarettes, nicotine in chewed form of tobacco, any form of nicotine would lead to, would act as a stimulant to the brain. And then if you are, first of all, it's bad for health for all the other purposes, but it's also bad for sleep, right? And so you need to curtail your stimulant usage. Funny thing is, I've had patients who come with insomnia, who can't sleep. And when you ask them, what are you doing when you wake up at night and you can't sleep, is that they are smoking. So you have a person who's smoking 2 packs a day, smoking around the clock, and then the complaint is that you can't sleep. Well, it's like swimming your brain in nicotine and a stimulant, and then asking the brain to sleep. Those two things cannot go together, right?
Again, that vicious cycle, huh?
Right. Yeah, when you wake up, you can't sleep, then you want to smoke, and when you smoke, you can't go back to sleep.
These are all such interesting points. I mean, it's such a low-lying fruit, but it makes such a world of a difference. Like I've had so many patients, even, I mean, not, I'll use from a personal, my mom, she has to have tea before she goes to bed. And the response I always get from her is like, oh, it helps me sleep good. And I'm trying to explain to her that the only reason you're sleeping good is because you've been awake long enough. And it's not, the tea isn't what's going to make you sleep good. Because you've been awake for about 16, 17 hours, you are biologically designed to now fall asleep. Mm-hmm. What the tea will do is it'll interrupt your sleep once your sleep drive has sort of worn off. Once your appetite, once you have consumed enough sleep over that 8-hour period, after about 4 or 5 hours, then it is going to be that residual caffeine in your bloodstream that is going to start waking you up in the early morning hours. So yeah, definitely
I feel like tea is I feel like tea is used for boredom sometimes. You don't have anything to do, so you make a cup of tea. And I'll give you the example of my father.
It's better than alcohol, for sure.
Yeah, he called me really early in the morning. It was like 4 a.m. I said, Dad, you woke up? He said, yeah. I said, what are you doing? He said, I make a cup of tea. I said, why are you drinking a tea at 4 a.m.? He said, I'll drink that tea and then I'll go back to sleep for another few hours. I said, no, that is not the use of tea. So he was basically getting bored, not knowing what to do. He'll make a cup of tea. But I tell patients, that tea can, relax you. The benefit of tea at bedtime could be just having a hot drink at night relaxes your mind. But you can drink non-caffeinated products. You have a lot of herbal teas, a lot of teas that don't have caffeine or the theophylline. Then you use those herbal teas if you just want a hot drink close to bedtime.
Yeah, and that again just like highlights the importance of associations that you were alluding to. Right. Like having associations that are conducive to sleep versus having associations that are not conducive to sleep.
Right.
And if you have associations that are not conducive to sleep and you replace them with sleep conducive associations, your just ability to fall asleep better and stay asleep longer, it just works out so much better.
Absolutely. That is absolutely right. So we wanted, we touch about a lot of these things, but these are, I think this is the most important slide. If somebody just wanted to capture this and try to take it to their clinics and just, teach patients for 2 minutes on these things, I think this will be extremely helpful for rest of their life, basically, to sleep better. Number one, keep a consistent sleep-wake schedule. Don't go to bed when you're not sleepy. Don't try to force yourself to sleep. If you're not drowsy and you're forcing yourself, that is a perpetuating factor for insomnia. That increases your insomnia, increases anxiety, increases frustration that you're not sleeping. Get out of bed if you're not sleeping for more than 20 minutes. But once you get out, you don't go into a light environment. You stay in a dark, stay calm, do a light reading, listen to some light music, and then try to go back to bed, and don't drink tea when you wake up at night. Use bed for sleep and intimacy. So you need to make an association between mind and bed and sleep. Quiet and relaxing sleep environment, pretty self-explanatory. Reduce light in the evenings. You don't want, and this actually was a very interesting, we were discussing this, Sahil, the other day, that in India, I've noticed all the light is a very blue spectrum light. We have very white CFLs, very white tube lights, and the temperature of these lights is, it would be less Kelvin, right? 22 to 2700 Kelvin. Whereas as you go to the Western countries, you have a more warmer color tones in the lighting systems. You have, 3000 Kelvin, 4000, and so. So what that does, we know that the bluish spectrum of the light is actually the most stimulating to the brain. So at night, if you, after 8 o'clock, you're sitting with all your 4 CFLs and really, bright light on, you're telling the brain it's basically day. And you don't want that. You want to tell the brain that it is evening, it is nighttime now, and you need to relax and sleep. So reduce the light in the evenings, get a lot of bright light in the morning. So a lot of sunlight in the morning. And then avoid a large meal before bedtime. Make sure you eat at least 2 or 3 hours before bedtime, so your gut has already done the processing work, and you don't want your gut moving or your stomach churning at night when you go to bed. That is not going to help you sleep. Regular exercise, early exercise, avoid caffeine and nicotine, avoid alcohol before bedtime. I've seen, there's a concept of nightcap. So you take a drink to go to sleep. What that does is it only transiently makes you drowsy, and you may even fall asleep with alcohol. But once that alcohol is wearing off, it is actually leading to a very fragmented and poor quality of sleep. You snore more, you wake up more, you get more apnea after alcohol. And because alcohol makes you drowsy, unnaturally out of sync of your biological night, you develop an internal clock issue with that. So you really want to avoid alcohol before bedtime, and pretty much limit a lot of fluids before bedtime. Drink 2 or 3 hours before, stay hydrated, but don't drink right before going to bed, because you don't want to wake up multiple times to empty the bladder.
That's such a good slide, Saurav. Do you mind going back again?
Yep.
I just wanted some things that came to mind. I mean, I think you emphasize the lighting very well, and I just wanted to re-emphasize that. I mean, if you take people who claim that they can't sleep and they have insomnia or have been labeled with insomnia, you take them out of their pre-existing environment and you put them at a campsite for 3 or 4 weeks, and their internal clock will resynchronize with the moon and the sun. And that insomnia will essentially disappear over a course of a couple of weeks. And it just sort of, again, highlights that evolutionary story of with sleep and how humanity is progressing, and how light invasion has really made it more difficult for us to fall asleep at a timely hour at nighttime.
Yeah, agree. And this is also going back to the basics. All these boot camps, these lifestyle camps are basically taking you back to the basics, right? And in India also, you see a lot of rural India, people sleep outside. In summers especially, they're not sleeping inside. So what that does is that really very well regulates their sleep. When the sun rises, there's no curtain to avoid that light. You get all that bright light. And when it is evening, there's no light outside to keep it bright. So you get the natural darkness. And that's really, you know, going back to the basics, and it really corrects your sleep like anything else, right?
Absolutely.
So treatment options. Once you think that you have bad sleep, what can you do on your own? And then what next steps you should take? I think a lot of poor sleep is going to be bad sleep hygiene. And we just touched on it right now. And just by following good sleep hygiene, you can correct a lot of bad sleep. You may not correct sleep disordered breathing. You may not correct restless legs and a lot of other problems. But problems related to sleep quantity can be corrected by following good sleep hygiene and syncing your internal clock with your sleep and wake timings. Avoiding naps during daytime. Even if you're getting sleepy, don't take a later day nap. Take a short, less than 30 minutes nap if you want to feel refreshed. That helps in building your sleep pressure at night. I think of naps as sleep snacks. So like your mom tells you, if you are going to go for dinner, don't eat a snack. Your appetite will be gone. So similarly, don't take a sleep snack, because then you can't eat the sleep dinner. So, so that's how it is. Avoiding stimulants, keeping a sleep diary. So sometimes, because we don't have a memory of more than a couple days of what we were doing, how many hours we slept, and we have seen a lot of patients with insomnia misconstrue their symptoms because their recall is poor. So they don't really know how many hours they slept, when are they going to bed, when are they taking a nap. And just by keeping a sleep diary, it's extremely intuitive way of doing it. And then you can then actually visualize, what are you doing wrong? Are you taking too many naps? Are you getting light when you should not get light? Are you going to bed late? Are you waking up and drinking a tea? So all those things you can just visualize by keeping a 2 or 3 weeks of sleep diary. And then, you tried good sleep hygiene. It's not working out. Then you make a sleep diary, and that's very helpful for your sleep doctor, and then try to contact a sleep doctor and then get evaluated for that.
Sleep diary, I think that's a good reminder to me. I don't think I ask patients enough to keep it, but it's such a useful objective and subjective tool. It's an objective tool based off of subjective, symptoms and timings of what's going on, and it just really highlights, and it makes it a lot easier for someone to tease out what somebody might be doing wrong or that is not conducive to sleep.
Yeah,
So
I think it's
point.
almost like calorie counting, right? One big thing with weight loss is count your calories. So just write them down. And just by writing them down, you start to realize what is wrong. What am I doing wrong? So just by writing down, your sleep diary, you may realize what you're doing wrong. Yeah. So Sahil, I'll hand over to you. Let's see.
Yeah. We're a little bit short on time. So I'm just going to quickly zoom through some of these slides. As Saurav was mentioning, what to do next. If it's for everybody, sleep conducive habits are extremely important. Let's say somebody has an internal clock problem, and as Saurav had alluded to, an example would be that it's actually 9 p.m., but the internal clock thinks that it's actually 7 p.m. And until it's at 9 p.m., the internal clock will be thinking it's 9 p.m., but it's actually 7 p.m. So the person will start falling asleep earlier. And if it's 1 a.m., the internal clock will be thinking it's 9 p.m. So either the internal clock can be delayed or it can be advanced. And as Saurav was mentioning, that light and melatonin have a big role to play. If somebody has an internal clock that is a little bit delayed, then making sure that environment is void of bright light, blue light, and is filled with darkness and melatonin can help them fall asleep sooner. And the dose of melatonin should be a small dose of melatonin. It doesn't. The larger doses of melatonin can lead to a hangover effect, and they won't necessarily fix the problem. So anywhere between 0.5 to 5 milligrams is adequate. And if you have somebody who has a tendency of falling asleep earlier, around, let's say 7 p.m., when they actually want to go to bed around 9 p.m., then exposing themselves to that kind of blue light that you were talking about, or bright light in the evening hours, will help regulate their internal clock. So it will think that it's getting, the body's nighttime is happening later and later. So we talked about sleep conducive habits. We talked about internal clock problems and what can be done. And one thing to remember is, sleep does not get fragmented overnight. It usually takes many weeks or months and sometimes even years. So expecting an improvement in sleep will also take time. So having consistent habit, just like weight loss, which was a good example, takes time. Getting your sleep back on track will also take weeks, sometimes months. So it's important to be patient. Let's say you've done all of these things and you're still not feeling well. Then the question becomes, well, we need to do a sleep test. A sleep test is basically getting insight into your own sleep. And it can be measured as a reflection off of the EEG waves from your brain, or it can be measured indirectly from breathing or some of the other outputs of sleep. So as you can see in this picture, this person is sleeping in a lab. They have leads that are on their brain, on the chin muscle. They have some leads on the chest and the abdomen, as well as a sensor on their finger. And these are all data points that we would collect typically in a laboratory sleep study. The other form of getting a sleep test would be through a home sleep test. And with technology, things are becoming easier and easier. And they have been condensed now to something wearable that goes on your finger and has a wrist monitor, as well as maybe just a single lead on your chest. So getting a sleep test at home is they're extremely precise and accurate. If the question is to see if somebody has sleep apnea, if it's other problems, then maybe doing a laboratory might be the best way to go. But with sleep apnea being as prevalent as it is, a home sleep test is a perfect way to start, and it's actually very much cost effective as well.
Yeah, and that's an excellent point, because I think when you think about the population having about 7 to 8% incidence of abnormal breathing and sleep apnea, I feel like going forward in future, the home sleep testing is really the future of sleep apnea treatment, diagnosis and treatment, right?
Absolutely. And then even like moving forward, I think what's going to happen, it's just a matter of time before this happens, that we have even more advanced sleep tests that are measuring different outputs of sleep, some different neural circuits, from different outputs of this neural network. Either they may be a patch that goes on the forehead or something that goes on the chin, and they even have small oximeters that actually use that data to then estimate what's happening during sleep. So it's really exciting to see how easy it's going to become for people over the next 5 years or so to get a diagnosis of sleep apnea and get some more accurate insight. And so let's say somebody does have sleep apnea, and the treatment should really be personalized. And I'm just going to quickly go through this, and it just depends on how severe something is, what position their sleep apnea is worsened, and what other comorbidities one may have. If somebody has any spectrum of sleep apnea, then what's shown here is a Cpap machine. The way this machine works is it basically, with a seal over the face and a mask, and there's over 100 different kinds of less obtrusive masks, it pushes air in, and as a result, it keeps the back of the airway open, because the primary problem in obstructive sleep apnea is that the airway gets blocked off during sleep. So the idea is let's use air to sort of stent open the airway so it doesn't collapse during sleep, preventing someone from waking up and preventing them from having a drop in their oxygen level. So using air as sort of what's called a pneumatic stent, using air to stent open the airway while sleeping, is a very effective strategy for all forms of sleep apnea. We just have to remember what other comorbidities one may have, because it is obtrusive and you don't want the treatment to be worse than the disease. If somebody has mild sleep apnea, then maybe an oral appliance may not be the best thing to do. Other options are things like it's called a mandibular advancement device. It's basically sort of like a mouth guard that pulls the jaw forward, maybe 1 centimeter, 1.5 centimeters while sleeping. And as a result, you can see here that there's more air that can pass through the nasal cavity and the mouth as compared to somebody whose tongue and jaw are falling back during sleep. So then the idea again is either you can keep the airway open with air, or you can keep it open with just pulling the jaw just a little bit forward to prevent it from blocking off. And then this is a new product that just got FDA approved, and it's basically a tongue stimulator. It stimulates the tongue so the tongue is stronger and it prevents it from falling down. So I think we're going to get very creative over time in terms of like different kinds of therapies, how it can be personalized for people who have a different spectrums of sleep apnea. And this has been approved for snoring and mild obstructive sleep apnea.
Yeah, and on that tongue part, Sahil, we also, I'm not sure if you were going to talk about that, but we are doing now the hypoglossal nerve stimulator. So basically nerve stimulator to move the tongue forward around the same line, causing mechanically less obstruction, the apnea.
Exactly. And this is that nerve stimulator that Saurav was talking about. It has the ability of sensing that the diaphragm is not moving and the airway is closed. So let me send an electrical stimulus to the tongue so it can push it forward so I can take a deep breath. So I think that the technology is only going to get more advanced over the next decade, and it'll be interesting to see what all sorts of therapies are available to patients.
Yeah, and I was reading
this.
You
Update us on fatality of sleep apnea, current fatality, if they don't use any of these devices.
Okay, but I think like by itself, it's really hard for somebody to die of sleep apnea. But what happens is the comorbidities of cardiovascular disease, diabetes, obesity, all of those compounded over time, then the patient would die of a heart attack or a stroke or something along those lines. But just sleep apnea by itself does not, I have yet to see somebody who died just of sleep apnea. I don't know, Saurav, if you've had that experience.
It's been hard to analyze, Dr. Bhandari. There was a large scale study. They tried to do a retrospective study to look at the mortality of sleep apnea. They couldn't get a very nice answer. The reason is it's just associated with so many things. To try to statistically isolate sleep apnea as a causation from obesity, from diabetes, from heart disease that is all coexistent with these severe sleep apnea patients has not been possible. So they did a study, they looked at the numbers, they could not get a statistically sound association, but the discussion really on that was that it's very hard to isolate a death from sleep apnea, because really in severe sleep apnea, you will always have either a heart disease or a stroke or something else that is the leading cause of that. But then if you backtrack, you may associate that all happened because maybe the patient had severe sleep apnea for a long time. So that is the dilemma in sleep medicine. We wanted to try that. We have not been successful so far to get a solid mortality number on sleep apnea.
One more question, because this is very pertinent, because some of our participants are physicians also. Yes. Unfortunately, like every specialty thing, you guys are talking absolutely rational, but thinking in terms of getting a sleep specialist in a country like India is totally not possible. And most of the times I see the portal of entry is general physicians or even specialists are free to address yet another symptom of the patient. It is absolutely irrational, drug dependent, non-investigative, non-analytical. What should be your message to the people? Because the doctors also, I have a colleague and he takes melatonin for years. And he keeps on arguing it's not addicting. I said, what is the definition of addiction? You can't sleep without it. It may be. So I think it's very important to convey through this that sleep is a specialty in itself. It is not equivalent to giving Valium and going on augmenting the doses. you have to look for something. And more important, what I found is the quality of sleep. Once I shared a room with somebody, and this guy was sleeping like a log, and the first thing in the morning, I couldn't sleep in the night. So obviously, they are not talking about the sleep per se, but the quality of sleep. So I think address, Sahil, if you could give a brief to the doctors, how should they approach this problem?
Yeah, that's a really good question. I think it's a challenge, even in the United States. That's why even in the United States, almost 80% of sleep apnea is still undiagnosed. It's a relatively new problem that people are becoming aware of. I mean, I grew up thinking if somebody was snoring, it was okay. But now we know that just isolated snoring is not, it's pathologic. Nobody should be snoring. And trying to tackle that, home sleep testing will be playing a fundamental role in helping people get diagnosed in a timely fashion. These home sleep testing devices actually have the ability to generate a report that anybody with limited knowledge in that space can understand and see that, okay, this person has either very severe sleep apnea or they don't have sleep apnea. So I think having access to a home sleep testing organization in your area or online is going to be, that can be, I think, a solution to this problem. And if somebody is endorsing that they don't sleep good and they have to take medication for it, I think that by itself should raise a red flag. Sleeping is just fundamental. It's like saying that I can't eat, sleep, they all fall into these very evolutionary, strong, biologic, fundamental activities that one participates in over a 24-hour cycle. And if somebody said to me that I can't eat, that would be like a red flag automatically. And I think if somebody says to you that I cannot sleep or something is wrong with my sleep is such a natural thing to happen that if somebody is saying that they can't sleep and they have to take medication for it, that should raise a red flag and at least maybe trigger the possibility of doing a home sleep test. I don't know, Saurav,
I would add a few things to that. I think for all my general practitioner colleagues or people who don't have access to sleep physicians, the number one thing is don't disregard or don't minimalize sleep.
True.
First thing is, the awareness in the community via, these webinars or these educational talks that, having a poor sleep or bad sleep is not normal. And then, when patients realize that, then they will go to the doctors and tell them. And then doctors also need to listen to the sleep issues as keenly as they listen to, somebody having a chest pain, or obviously those are more acute issues. But we should not minimalize somebody's poor sleep. And then instead of right away thinking and putting all the bad sleep into one bucket of insomnia, we need to just give it a little bit more time and just ask them a few more questions. Why can't you fall asleep? What are your sleep timings? And if you just give 5 more minutes to that history of poor sleep, you will automatically start to understand what is the reason behind it. And if the reason is not, primary insomnia, and it is secondary insomnia, secondary to stress, secondary to sleep apnea, then you would obviously try to do that rather than adding, like you were saying, medications to try to just bandage the sleep, right? The other thing is, even for insomnias, medications are not the first line treatments. The American Academy of Sleep Medicine has it everywhere. The first line treatment is behavioral changes or cognitive behavioral therapy for insomnia, which actually is available online right now, Dr. Bhandari. If somebody has insomnia and it's chronic and it's not secondary to home sleep apnea, they can go on websites and get a 6-session protocol for what is called CBTI, or cognitive behavioral therapy for insomnia. And these are FDA approved, validated sessions that basically teach you about the principles of good sleep hygiene. They do sleep restriction, and then they do sleep compaction, and then they expand the sleep over the next session. They talk about light and darkness. So I think that online is available, should be used by doctors in India if they don't have an access to a sleep doctor. Use the online resources for CBTI. use the home sleep apnea testing. I mean, right now the test with a pulse oximeter device that gets your heart rate and gets your pulse ox, you are using machine learning and artificial intelligence to then look at the apnea data from it. You don't even need a probe on the nose or any probe on the chest. So I think that Sahil, was mentioning technology, online resources, understanding sleep is a basic fundamental process and should not be broken. And just giving it a little bit more importance and a slightly more minutes in talking to your patient, I think will improve sleep care.
Again, going back to if there's any kind of a positional sleep apnea, if you don't have the resources, you can put a tennis ball on your back. It's sort of a joke, but it works. If you are able to afford, then there are products on the market that will train you to sleep on your side. And surgery does play a role. Not a first line role, but if somebody's upper anatomy is distorted, there are surgical interventions that can be done to fix or try to fix the problem, but they can be very morbid and are not as effective as some of the non-surgical therapies that are available. Thank you, Dr. Mandari. It was really good questions.
Yes. And if we have just a few more minutes, I'll just answer some questions that were really interesting. So we've been asked, suffering from insomnia, taking Zolpidem. I could not sleep when we stopped taking it. So that is, a lot of our patients, started on medications, like Dr. Bhandari was saying, not all of them, but a lot of them could be addictive. And addictive in the sense that there is a physiologic dependence on these medications for sleep to happen. But we know that long-term or chronic use of these medications, first of all, can lead to memory issues, side effects with falls and sleepwalking and abnormal behaviors at night. And then secondly, they can be masking your actual sleep issues. So if you were waking up because you had apnea, now you give a sedative to them, then you are blocking their arousals. And they are thinking they are sleeping, but the brain is still getting hypoxic at night. So I think getting off a chronic medication for sleep apnea, getting an evaluation is important. The way to do that would be talk to a doctor. I don't suggest doing it just by yourself. There could be some rebound effects on sleep. But tapering the medication slowly in conjunction with a sleep evaluation and a sleep test to rule out abnormal breathing would be the way to do it. Then
there's another question. I'll just go over the questions while have you answer them. Best medicine for patients without any comorbidities. Best sleep medicine for patients without any comorbidities.
Sleep hygiene.
Hygiene. I was going to say that.
Good sleep hygiene, good sleep behaviors is the best medication, and sleep is the best meditation. Just to add there was a quote from Dalai Lama. He said, "Sleep is the best meditation."
Sleep. There's a joke that. And it has so much truth to it that sleep makes everything better.
Yeah.
Like if you sleep on it, you will be able to think of a more clear solution.
Yeah,
if you're in a bad mood,
just go and sleep on it.
Yeah. If you're in a bad mood, you got an argument with your wife, your kids, something is wrong, you just go to sleep, you'll wake up in a better mood. It's just sleeping makes our thought process and our logic so much more clear. And it's like, and it's free. Like that's the thing that that we try to purchase drugs in the United States to help us feel better, but sleep is one of those things that is free, and it's sort of like the super drug that can make so many of our biologic processes just.
It should be one of those bad vegan things, right? I mean, this is working. It is free. Okay.
Now, I think, Saurav, Sahil brought a very good quote of sleep over. Really, it works, sleep over the problems. And physiologically, it makes a lot of sense that you don't have an instant solution, but you need time for brain to really think about it, and you rest and you are fresh. Is there any data to show decline or evolution of sleeping hours with chronological age?
Yes, there is data. When you look at the National Institute of Health's data on the sleep requirements and the sleep durations, with age, they do decrease. Initially, when we are born, we have the maximum sleep requirement. could be up to 18 hours. Slowly reduces 14 hours, 12 hours. In adults, 7 to 9. In 60 plus, 7 to 8. 65 onwards is the least, 7 hours, I think, on an average. So it does decline, and we don't know, but Dr. Thomas, who was our mentor at Harvard, he thinks of sleep in a very neurobiological way, and he thinks it's a breakdown of, as any organ system breaks down or degenerates with age, the degeneration of neuronal connections and the network of sleep leads to a breakdown in the amount of good sleep we can get. And it happens more faster in patients who have Alzheimer's. In Parkinson's, these are the patients who have the worst sleep. Parkinson's has the worst sleep, very fragmented, poor quality, and neurology folks, when I talk to them, they address not only their symptoms, but they're also very worried about their sleep at night.
Yeah, and the other thing, Dr. Bhandari, like, not only does the sleep duration change, but the architecture of sleep changes too. So the amount of like deep sleep that one would have as a child will be significantly less over the course of when they're in their 60s or 70s. The amount of REM sleep also decreases substantially over time. But definitely, like the deep sleep is, I think, what is affected the most over time. So there's a question here, Saurav. Obstructive sleep apnea over long duration can exacerbate depression.
Yes.
What are your thoughts?
Yes, it's like an interdependent relationship. It can worsen depression. Depression worsens poor sleep. So there is a relationship there. Yes.
I'll take the next one. How about melatonin? Do you think it can help? So again, it depends why one is taking melatonin. If it's for the internal clock being advanced or delayed, or if it's for the internal clock being delayed, then using melatonin in darkness can help. And it would need to be a much lower dose. And once the internal clock has been synchronized to where you want it to be, then one can stop taking it. But again, if we have sleep conducive habits and we are healthy in general, we shouldn't require a medication to fall asleep. It's just such a evolutionary simple thing to do that if someone is having to take a medication to fall asleep, something is pathologic. Here's a question for you, Saurav. A lot of people taking sleep pills, how does it affect them in the long run? This is a good question.
Yeah, I think coming back to the same point, sleeping pills may be masking your sleep issue. They may be masking what is behind a poor sleep. Is it a clock? Is it a breathing? Is it stress and anxiety? What really is behind the sleep needs to be addressed. In acute insomnia, let's say, somebody died in your family, God forbid. Somebody is really sick and you can't fall asleep and you need to sleep to function. In acute insomnia patients, sleep medication, sleep aids are used to let the patient tide over that crisis and then work simultaneously with them to figure out what is the reason behind it. But in chronic insomnia that are lasting more than 3 months, to give somebody a sleep aid is really not the right way to treat it and will have long-term consequences depending upon what medication they're taking.
Absolutely. Here's another question. If somebody has sleep paralysis, is that associated with a sleep disorder?
Yes, absolutely. That is a symptom of sleep deprivation. So either, or I should say the word sleep insufficiency, either due to quantity or quality of sleep being bad, the brain can get sleep paralysis, which is the conscious mind is awake, but subconsciously brain is still running the neuronal networks of sleep. So your body is paralyzed. Your subconscious mind is in the sleep phase and the conscious mind is in the wake phase. And that's really what sleep paralysis is.
And I'm just going to add that, having 1 or 2 episodes of sleep paralysis per over a lifetime is normal. And even up to maybe once a year, once every couple years. But if this is like a recurrent problem and it's happening many times per year, then it should definitely trigger one to get some more history of what can be going on. Next question, Saurav, is many pregnant patients complain of disturbed sleep or insomnia. Does it need any specific management? Right now, this provider is using alprazolam.
I would say no. Pregnancy is one of those metabolic phenomena, which is very interesting. The whole body is going through so many endocrine and metabolic changes that sleep can get fragmented, and the reasons can be many. When depending upon what trimester they are, if their diaphragm is being pushed, lying down, if their IVC is being compressed by the uterus, they can't breathe well at night. They have to be on the left lateral positions to get a good respiration going on, because of release of all the hormones. And we know that progesterone and estrogen have a strong effect on sleep, and that's why people going through menopause also develop bad sleep because of the imbalance of these hormones. So yeah, pregnancy sleep can be poor, but I think as we avoid any medication in pregnancy because they've not been tested on the developing fetus and baby, we should try to avoid medications. Alprazolam, I think probably could be one of the safer ones, even though it's a benzo. I know melatonin, we still try to avoid it, even if it is a very benign sleep drug. I would say, good sleep hygiene, trying to rest in a proper position where breathing is good, taking a warm shower before going to bed, following a good routine, relaxation would be the things that I would suggest for good sleep.
Absolutely. And I just am going to add that, iron deficiency can develop during pregnancy, and it's possible that this person may have symptoms of restless legs that could be driving the insomnia. Yes. The other thing is, as we have more volume on our body, that volume is going to get dispersed everywhere, including the upper airway. So it's very common to see women in their third trimester snoring, who did not snore when they were not pregnant. So it's possible that they may have developed some degree of mild sleep apnea that could also be fragmenting their sleep. And in that situation, all the alprazolam is doing, it's changing the threshold for their arousal, and so it can be used. But I think if after everything that Dr. Luthra said, then maybe getting a sleep study at one point might be useful. Or especially if they're endorsing that there's a lot of snoring and they wake up in the middle of the night short of breath.
Yeah, I think and then simple techniques would be left lateral sleep is considered to be the best in terms of avoiding the compression on the veins and the lungs. And then propping up the head of the bed using, instead of 1 to 2 pillows, or sometimes people say put a blanket under the mattress just to elevate the head end of the mattress 10-15 degrees can help relieve some of that airway obstruction that may be waking them up. So simple things can work there too.
Absolutely. Question, how is restless legs treated?
So restless legs, the number one pathophysiology we know so far is the deficiency of iron in the brain, specifically the neurons in the CNS or the central nervous system. So number one thing we try to do is check your iron studies. And if the iron stores are depleted, and they may be showing up as normal as per the lab values, because you may not be iron deficient to cause anemia, which is the low hemoglobin level, but you may have low iron levels that can cause restless legs. So we try to deplete the iron stores to the max that we can safely. And on top of that, if the symptoms are still going on, they are moderate to severe, then we would use medications. And there is 2 or 3 classes of medications that we would use. Common one would be gabapentin and others that we would use to treat that.
Absolutely. I think the iron cannot be highlighted enough, of making sure that the iron stores have been repleted.
Yeah, I remember, Sahil, in MBBS, we used to read a very nice textbook in pediatrics that talked about iron deficiency in children and restless sleep and restless legs. And it was just, glided over so fast. But, when I got into sleep medicine, it just clicked back. Oh my God, we used to read so much on iron deficiency and legs in pediatrics, but we never, thought of it unless, we got these patients in the clinic.
Yeah, absolutely. This is a good question. Does meditation really help to improve sleep or have a peaceful sleep?
Yes, I think meditation goes back to your conditioning and pre-bed habits. The 30-45 minutes before sleep, calming your mind down with meditation will help, because basically you are calming your conscious mind down so it's not racing, it's not thinking about a million things. and that will help in inducing sleep.
You know, one of the things I tell patients in clinic is sleep is not, it's not an on-off switch.
Mm-hmm.
You know, you have to prime yourself to fall asleep, and you have to then, and that priming will take at least 30 minutes to an hour. So like having some sort of a wind down routine after having dinner, maybe some TV, dim the lights, and then over the course of the next hour, just having a wind down routine, shower, brushing your teeth, reading a book. These are all sort of priming you to fall asleep in an efficient fashion. And meditation can totally fit in with that because it's conducive to sleep instead of like smoking or nicotine or caffeine that is all non-conducive to sleep. Television is non-conducive to sleep immediately before bedtime.
Yeah.
I usually wake up 2 or 3 times whenever I'm in stress. What can be done? Otherwise, I'm good during when my alarm wakes me up.
Yeah, if you're waking up too many times due to stress, try to reduce the stress. I know that it is hard. You know, we are all stressed, especially in the pandemic. It's very hard, and it's very easy to tell the patients to reduce the stress. But I would say, you know, meditation, for example, can help to reduce the stress before you go to the bed. Try to put the glass down. You know, we have this phrase, whatever, you know, you are spending the time at night, you're not going to fix the problem at that point. So try to meditate, reduce the stress. Do not spend too much time in bed, especially with people with stress. I've seen they will spend 10, 12 hours in bed and then keep waking up. And that's partly because the brain, you know, thinks of sleep like water. If you put it in a big dish, it will all fragment, it will separate. So you want a smaller dish. So try to limit your time in bed, sleep 6, 7 hours in bed, and the rest of the time stay awake. So even if you are stressed, the brain still has only 6 hours to get all the sleep it needs, and it will keep it compacted. And then you have to work on strategies to reduce the stress. Medications I was mentioning earlier for acute stress leading to insomnia, leading to functional impairment can be used, but with the advice of a doctor who understands what they're doing.
Absolutely. And just, you know, going to bed when you're sleepy. We know that the idle mind is a devil's workshop. So like going to bed and giving your opportunity to have an idle mind is, again, not conducive to sleep in any way or form. Another question is, and you had alluded to this, so I'll just quickly mention, does insomnia have any relation to hereditary? So there is a genetic predisposition. You can have people who have genes that are conducive to, I don't want to use the word insomnia, but short sleeping. So there are people who genetically are short sleepers, while there are people who are genetically long sleepers. There's a question here of, what about napping during the day? Is it beneficial? We talked about this as well, that if your taking a short nap that is not too close to when you are going to consume sleep, so your nighttime sleep is okay. Now sleep at nighttime because you are snacking on naps during the day, then eliminating naps is going to be important. There's a question here about how to relieve insomnia from a baby. You know, that's a complicated question, and I think we would need to have more information. But again, it depends on the age, and having an environment that is conducive to sleep. So in children, their circadian rhythm has not completely developed. So it's important for us to develop that environment that is conducive to sleep, so these children can have a routine of falling asleep and then waking up. And depending on the age, kids, it is normal for them to wake up in the middle of the night, but it's also important for us to have associations that allow them to fall asleep quickly. Like for example, if a child has the association of nursing or watching television before bedtime, then every time they wake up, they are going to look for that same association before they go back to bed. So gradually eliminating those associations and just developing associations that are free of a parental intervention are important. And there are other techniques that I'll let Saurav, if you want to talk about
Yeah,
the
no, I
Ferber
think there is
method.
a whole behavioral sleep medicine. In child, in babies, insomnia, it's all 99% behaviors. Sleep associations, understanding how sleep is induced, giving them a good sleep environment, a habit, when they are expecting sleep, when they are expecting a nap, avoiding, for example, and then it matters on the age, when babies are very young, they need 2 naps, up to 2 naps a day. Later on, they may need only 1 nap a day. So I think based on the age, it's all behavioral. You don't need typically, anything medical or pharmacotherapy to do that. It's about developing a routine where they are sleeping, good sleep environment, doing it consistently and every time, associating it with a bath or a good sleep association would help. And then it will be very variable based on what somebody's particular problem is.
Right. There's a question here of REM and non-REM. I don't completely understand.
I think they were asking us to shed light on REM and non-REM. I try to avoid that, but I think I mentioned that in the sleep stages. We have non-REM basically is the sleep which is not REM, which is not rapid eye movement sleep. The purpose of the non-REM sleep is to go from one sleep stage to other, and then do a lot of housekeeping work for brain. So a lot of restoration, processing, thinking is happening in that. The REM sleep is your dream sleep, and we get about 40 minutes of REM sleep every cycle of 2 hours. There is a progression of REM throughout the night. So as the night progresses, you get slightly more REM. REM is where you get dreams. Dreams you can get in both non-REM and REM, but the REM dreams are more vivid and you tend to remember them more. What the purpose of REM is not entirely clear, but we think that it also helps in memory processing. It helps in consolidating your memory. So for example, you experience something which was life-threatening during the day. The brain wants to save that memory forever. It doesn't want you to forget what is important for your survival. Whereas, there are hundreds of things that we do that may not impact our survival, and evolution-wise, brain will try to delete those non-important memories and save the important experiences for us to remember. So we think REM may have a role there. And that's basically, what REM and non-REM would be.
There's a question here, how long melatonin can be taken in insomnia? We briefly talked about this already, so I'll skip it. Is it normal to feel breathless during a bad dream and not able to move a part of the body?
In a bad dream? Yeah.
Correct, yeah.
I think that one of the purpose of the dream phase of the sleep is to paralyze the body, because if you are running from something in the dream, the brain doesn't want you to leave the bed and start running. So it paralyzes the body, so you don't act out on your dream. So it is actually normal, and physiologically what would be abnormal is you are dreaming and then you are acting out in that. That would be a REM behavior disorder.
There's another question. Sometimes I like to sleep on holidays. However, I just can't, because the moment I wake up, I have to get up. Otherwise, I have a headache. There are very clear associations that if somebody has sleep apnea or insomnia, that can exacerbate migraines. If somebody has a sleep apnea, that can exacerbate TMJ, jaw problems that can present as migraines. Patients who have grinding of their teeth or bruxism is also associated with sleep apnea. So I think we would need a little bit more history, but if somebody has symptoms of snoring, positive breathing, bad sleep, then these could all be, waking up with a headache could be a manifestation of an underlying problem.
My understanding is, correct me if you guys don't agree with, that if one follows a healthy lifestyle, eats well, healthy food, physical exercise, occupied doing productive work, sleep becomes a non-issue. It becomes an involuntary function.
Yes. Yeah. It's a basic evolutionary function. The body will cycle through it as long as nothing pathological is going on. So good lifestyle, good, timings for sleep, exercise should automatically give you a good sleep. Yes, absolutely.
And what you guys have said, that big message you give, which I put it into few sentences is that when you have a sleep disorder, don't treat it parallel to just medication. Think of everything and try and find out cause and effect relationship, which no doctor would be able to do until you interrogate yourself or maintain the diary. And then go as a knowledgeable patient to the doctor to find a solution. Certainly, there would be organic sleep disorders which would need much more than what you talked about, Alzheimer's or Parkinsonian. But by and large, healthy people talking of sleep is indicator of poor society.
Yeah, that's true.
That
And
a historical statement?
no, I think those are golden words, Dr. Bhandari, that, when a patient goes to a doctor, you need to try to understand what is wrong with you. Then you get the best, response or, reaction from the treating physician. Because if you just vaguely put out your symptoms and you don't know exactly, you may not get the, the treatment that you're looking for. And the other thing is there's no dogma about bad sleep. I have some women coming to my clinic and they, almost laugh and shy that, they snore. There's no dogma about it. Everybody, a lot of patients are snoring. There is almost 8, could be an Asian population. India and China have more sleep apnea than US because of anatomically narrow airways that we are born with. So there is a huge incidence of abnormal breathing. Bring your concerns to the doctor. Sleep is not benign. Sleep is not passive. Sleep is an active network phenomena. Only your conscious mind is sleeping. So if you have bad sleep, don't hide it. Don't feel ashamed of it. Talk about it, read about it, bring it to your doctors. And then as long as you are healthy, part of being healthy should be having a healthy sleep.
Well said, Saurav.
I think I can't thank you enough, because this is the right occasion to introduce why Vattikuti Foundation educational programs are different. And we bring in common issues which affect the population, and we find misunderstanding. And I have an advantage of working with big institutions and universities where I and Saurav and Vasvi had known each other. And I really take interest back. And like similarly, Maua, you would know,
Yes.
her husband is working in pain. So next thing I'm bringing pain. And when I talk to them, their reaction is that we'll talk about pain theories and all. I said, no, I want it to be dovetailed for a patient at a perception level. How should he handle his pain? How should he make sense out of his pain? When should he take painkillers? When should he go to doctor? And how should he handle his pain? And same thing I gave brief to Saurav, and this webinar has served a lot, because doctors know enough. They have enough resources. They can interpret Google much better. But the patients are deprived of resources because, unfortunately, when they come to consultation, we can't get over our technical language and terminologies in evidence-based medicine, which means nothing for the patient until somebody can translate it for. And our experience is very rosy about these webinars. And thank you very much, Saurav, for your time. And Sahil, it's good to know you.
Well, likewise, Dr. Bhandari. Thank you. The
We
pleasure was all ours.
Bank upon you again, maybe sometime on sleep apnea specifically. But I think if you want to say anything concluding, then otherwise Dave can take over and give his housekeeping.
Just wanted to thank you, Dr. Bhandari. I think this is a huge service to patients. And I think this webinar, to the people who joined today, and then to the people that we would share with it and try to spread sleep awareness is going to be extremely helpful, because awareness is how you start the journey to treatment. And so you're doing a great job on that. And thank you so much for having us both here.
Thank you, Dr. Bhandari. No, again, yeah, I think I cannot highlight that quote enough, that if sleep does not serve a very critical necessity, it's the biggest evolutionary mistake that was made to mankind. That again just highlights that, sleep is there. It serves a very strong evolutionary foundational role for our health, and that if there's something about it that is not good, one should ask a few more questions. And if anything is wrong in your life, sleep on it. It'll make it a little bit better.
Just for the listeners, Dave will tell, but let me tell you, our webinars and educational programs are not one time, they are longitudinal. So anybody, these video would be on website, the teasers Dave will make and put it on social media. They would be everywhere for people. We are pretty open. But at the same time, if you have any questions, please write on the website and we attend to those questions with the help of experts or our network people. So until there is a good reception, there is no point in unilaterally giving these lectures and things until they are well perceived. It helps society to deal with their own problems and help doctors to save their opportunity cost of time so that the patients are relevant when they present to themselves. They talk relevance. Dave, take over, and thank you very much, you and Joanna, for doing this great job.
Well, our guests today did the hard work, and that was a very informative presentation. Thank you, Dr. Chopra and Luthra, for your efforts today. Do either of you have a website or something that our viewers would like to know about?
Yeah, I do. Yeah, I run a online sleep clinic. It's basically patients would sign up online. We ship a home sleep test to their home. We interpret the results for them through a virtual visit, and whatever treatment they need, we ship it to their house. It's called empowersleep.com. And right now we're servicing the state of California with the plan of going nationally over the course of the year. And over time, we are going to be putting together a lot of educational content about these conversations that we had today, but they will be small 1-minute tidbits of information that is easy to consume, easy to understand, easy to remember, and also, most importantly, easy to apply into your own life. So stay tuned. There's more to come. We're just getting started on this topic of talking sleep, and we're really excited to share information.
And the only other website that I'll recommend, because we don't want patients going on and just reading everything, because some of that would not be scientific. So the website that I recommend to patients would be sleepfoundation.org. I think they have really curated materials which are given in layman terms so everybody can understand, and they're reviewed by the sleep physician. So the content is scientific. So sleepfoundation.org is a good resource. And then, Sahil would be putting on some educational material on his website too.
I think it's National Sleep Foundation, Saurav. National Sleep Foundation, NSF.org.
I found a sleepfoundation.org, www.sleepfoundation.org.
Okay. The National Sleep Foundation also has a lot of good information. And then obviously, I think the American Academy of Sleep Medicine also has a patient-centric portal or platform where they can get, doctor curated content.
We would be helped because we are currently revamping our website, and we are totally charitable. So if I would be very happy to put authentic resources for our visitors. So Saurav, and if you can help us with that, what Sahil talked, you talk makes a lot of sense, because one of the objectives is we can't really provide all the content, but we can really lead them to authentic sources to find.
Thanks again, gentlemen, for being here today.
Thank you, Dr. Bhandari. Thank you, Vattikuti Foundation.